University, Ottawa Heart Institute is teaming up with McGill University to launch a new platform that will help researchers access more data from across the country. It's called Archimedes and will help local researchers accelerate their life-saving work. I am joined this morning by Dr. Kelly Kobe and Dr. Jody Edwards from the University of Ottawa Heart Institute to tell us more about what this means for the important work. Good morning to you.
Good morning.
So first, Archimedes, can you tell me a little bit about what it is?
Sure. So Archimedes is a health data platform for Canadian health researchers, and it can be used for them to collect their data, to store their data, to share their data, as well as to do analytics on their data. So what's really new and exciting about this is that while health platforms exist in Canada, this is one of the first that has the ability to take on multimodal data. So what I mean by that is different types of data. So things like surveys, but also things like imaging data and biospecimens data, all in one centralized space. So what's really innovative is the ability to share that across the country, across different sort of privacy jurisdictions in a centralized spot where then we can run analytics on it.
I love that. You know, you touched on it a little bit, but how significant is this an advancement when you look in the future of what you guys are trying to accomplish?
Oh, it's really impactful. So I really think that the time is now for this type of resource for the Canadian scientific community. Canada has really, really rich health data. We have a very diverse population and we have a universal health system, but right now it's very siloed. So it's really difficult for providers to share that data, get it out to patients, and it's really hard to share across jurisdictions as well, across provinces. So this type of tool is ideal for this, and with the AI kind of revolution coming into healthcare, it's really the time the data needs to be structured in a certain way to enable the valid development and deployment of those algorithms. And so this is the tool that will enable researchers to do just that.
The technology in the AI world is it's moving at such a fast pace, but it's so great to take advantage of what we can use.
Absolutely.
When you look at something like this, why is it so unique compared to maybe something else that you've been using in the past?
Yeah, I think one of the things that we've done is we've developed the system in a very flexible way. So the researcher themselves can actually decide how they want to share their data and in what format and to whom. So we actually have the ability for researchers to share their data openly with all other researchers or within, say, trusted partners in their own institution or people they collaborate with specifically. Another thing that's really unique is our approach in embedding patient voices and patient perspectives. So there's different sort of ways you can share data, and one is through patient consent. And so we've really brought on patients from the inception of this project to develop it in a way that sort of meets their needs and has the patient at the core in terms of, how they want their data shared and protected.
And you talked about the collaboration, this with McGill University. How important is it to have these teams working together when you look at what we can accomplish in the future just to have this collaboration?
Yeah, I think this is a really unique opportunity for us. So to have kind of powerhouse institutions like the Heart Institute, the University of Ottawa, and McGill come together, they each have sort of a rich history of innovating in this space, but then by bringing them together, we're really sort of leveraging all of the development that's been going on to date and bringing it forward, and that in itself will make it something that has national and potentially global impact.
And when you look at something like this, like you said, it's not just here, it's going to have an impact vast beyond just our capital. Yeah. Where do you see the biggest failure or the most amount of opportunity with something like this when you look at some holes that need to be filled?
Yeah. So for me, I think if you think about the status quo of health research data management in Canada, it's very siloed. So researchers typically get funded by the government, they collect their data, and then it ends up on hospital servers, university servers, all over the country and not connected in any way. So Archimedes is really providing an opportunity for us to move away from that system towards one that is much more curated. So, we want to do AI and leverage our health data, but the bedrock of doing that is well-managed data. And so that's what this will provide.
An important collaboration, and it's nice to see that the AI too in a good way, in today's day. So appreciate the two of you coming on and talking about this new collaboration with us this morning.
Thank you. Thanks so much
for your time.